What if your doctor didn't actually want you to get better? What if the hospital needed you to stay sick, to stay profitable? In today's healthcare system, the longer you suffer, the more they earn. Life-saving procedures priced like luxury cars. Pills that cost more than rent. And behind every prescription, a handshake with a pharmaceutical giant. Insurance companies deciding who lives and who's just too expensive. The truth is colder than we want to believe. It's not about healing, it's about billing. 1 in 5 Americans is in medical debt, many for treatments they never even needed. And here's the terrifying part. Most people have no idea how deep this system goes. But after this video, you will. Hit like, subscribe, and let's go. In theory, modern healthcare should be humanity's greatest achievement. With advanced diagnostics, robotic surgery, life-extending drugs, and AI-assisted treatment plans, we are living in an age of medical miracles. Or so it seems. Behind the scenes, another story unfolds, one that's far less inspiring. The United States spends more on healthcare per person than any other country on Earth, yet ranks far behind in actual health outcomes. Why? Because the system isn't designed for healing, it's designed for revenue. Private hospitals run like corporations. Pharmaceutical companies racing not to cure, but to capitalize. Insurance providers crafting policies so complex, the average person needs a lawyer just to understand what's covered. And somewhere in the middle, the patient. You. A human life caught in an invisible machine built on profit margins and billing codes. If you're lucky, you get treated. If you're unlucky, you get ignored, or worse, overtreated. Over 30% of all medical procedures in the US are considered unnecessary, driven by incentives to prescribe more, scan more, cut more. And every year, millions of people are pushed into bankruptcy not by disease, but by the cost of surviving it. This isn't a broken system. It's a system working exactly as designed. But who designed it? And why does no one talk about it? That's what we're going to uncover, piece by piece. It didn't start with greed, not exactly. In the early 20th century, healthcare in America was basic and often local. Doctors made house calls, treatments were simple, and prices? Negotiable. But as medicine advanced, something else quietly crept in: opportunity. By the 1940s, private insurance companies saw healthcare not as a service, but as a product. The more they could control access, the more they could charge. And hospitals? They followed. Instead of healing centers, they became institutions with departments, executives, marketing teams. Then came Big Pharma. In the post-war boom, pharmaceutical giants exploded onto the scene, promising innovation, but building empires. Every pill, every injection, every trial, monetized. And through clever lobbying, they ensured one thing: no price caps, no real regulation. By the 1980s, the transformation was complete. Healthcare was no longer about wellness. It was an industry, a marketplace, and you, a customer. But here's where it turns darker. These corporations didn't just respond to disease, they began to shape it, influencing medical education, funding studies to steer prescription trends, creating new disorders, and marketing the cures before the public even knew they were sick. It sounds absurd until you look closer. Restless leg syndrome, social anxiety disorder, adult ADHD, all real conditions, yes, but all heavily promoted only after patented treatments were ready to sell. This is not medicine. This is manipulation. And the scariest part? It's still happening, right now, in plain sight. Every year in the United States, over 250,000 people die due to medical errors, making it the third leading cause of death. Third, just behind heart disease and cancer. Let that sink in. And yet, no headlines. No outrage. Why? Because the system isn't built to admit fault. It's built to protect profit. Take a look at your next hospital bill. A single Tylenol? $12. A disposable gown? $53. An overnight stay in a shared room? Sometimes over $5,000. And yet millions of Americans walk into these buildings every day, unaware they're entering one of the most expensive traps in modern history. Insurance companies deny claims using software that flags expensive treatments, not for being unnecessary, but for being unprofitable. Meanwhile, doctors, many with six-figure student debt, are pressured to meet quotas. More scans, more referrals, more procedures. The patient becomes secondary, or worse, invisible. And this isn't just happening to someone else. It's happening all around you. That elderly neighbor who had a simple fall and ended up with a $120,000 bill? That friend who was told she needed 5 tests before getting a diagnosis she already suspected? Or the family that lost their home trying to afford chemotherapy, not for a cure, but to buy more time? These aren't isolated stories. This is the new normal. And if it feels wrong, it's because it is wrong. But once you're inside the system, it's almost impossible to escape. So the real question becomes, what happens when staying healthy is no longer affordable and getting sick means financial collapse? Here's the part no one wants to say out loud. There is more money in treating illness than in curing it. Think about that. A cured patient is a lost customer. But a chronically ill one? That's a lifetime subscription. Diabetes, high blood pressure, anxiety, conditions that can be managed, not erased. And pharmaceutical companies know it. In fact, internal documents from major drug manufacturers show strategies not for curing diseases, but for maximizing treatment duration. It's not about helping people live. It's about helping them consume. And when researchers do find potential cures, they often vanish. Quietly. Inconveniently. Like the 2011 case where a promising cancer treatment was shelved because it wasn't commercially viable, or the scientist who uncovered a way to reverse certain autoimmune disorders, only to have his funding pulled by a board stacked with pharma investors. You might ask, is that legal? Shockingly, yes, because much of the medical industry is protected by lobbying. In 2023 alone, pharmaceutical companies spent over $373 million lobbying U.S. lawmakers. That's more than oil, more than defense, more than big tech. So when we wonder why insulin prices tripled in a decade, or why life-saving drugs cost 10 times more in America than anywhere else, the answer is chillingly simple. They can, and they do. The system isn't broken. It's working exactly as intended, just not for you. So, how much is your life worth, really, to the people who profit from keeping you just sick enough to come back? In labs across the world, scientists are racing toward breakthroughs that could redefine medicine. Personalized gene therapy that targets illness at the DNA level. AI systems capable of diagnosing rare diseases in seconds. Regenerative medicine that uses stem cells to rebuild damaged organs. Even cancer vaccines, not treatments, vaccines, are no longer science fiction. The technology exists. The knowledge is growing. But here's the unsettling truth. These advancements often move faster than the system allows. Why? Because real cures aren't always profitable. Take CRISPR, the revolutionary gene editing tool that can, in theory, erase genetic diseases. Its potential is staggering. Yet access remains limited, wrapped in red tape and blocked by patents. Or look at artificial intelligence, already outperforming doctors in diagnostic accuracy for certain cancers, but held back by outdated regulations and, quietly, by powerful groups who fear being replaced. Even medical data, your scans, tests, genetic info, is now a commodity. Sold, traded, locked behind paywalls. Some hospitals charge researchers thousands just to access anonymized patient data, the very data that could lead to a cure. So while technology moves forward, policy, money, and control pull it back. And that raises a troubling question. Are we living in a time of scientific renaissance, or being deliberately held back from one? The tools to transform medicine are here. But who gets to use them? And why haven't they been used for you? Some say it's just capitalism, that doctors, hospitals, and drug companies are simply doing what any business would, surviving, scaling, profiting. After all, isn't that the point of innovation? To be rewarded? Others argue it's deeper. That somewhere along the way, medicine stopped being about people and became about systems. And systems don't feel. They calculate. But what if both are true? What if the very progress we celebrate, longer lifespans, miracle drugs, surgical robotics, has a hidden cost? A cost we never agreed to pay. Because every advancement comes with new dependencies, new risks, and new markets. What was once rare is now routine. What was once human is now optimized. But optimized for what? Efficiency? Revenue? Or control? Some theorists point to a medical-industrial complex, a self-sustaining ecosystem where illness fuels research, research fuels investment, and investment fuels influence. And if that cycle breaks, billions are lost. So maybe it's not that cures are being hidden. Maybe they're just inconvenient, too fast, too final. Others believe the system is collapsing under its own weight, that doctors and nurses, once healers, are now prisoners of quotas, policies, algorithms. They're burning out, opting out. And patients? They're left to navigate a maze with no map, no guide, just invoices. So what really went wrong? Was it greed? Neglect? Or simply progress with no soul? The line between innovation and exploitation has never been thinner. And the scariest part is, we crossed it long ago. But did anyone notice? At some point, the system stopped serving people, and people started serving the system. You can see it in the numbers. Medical bankruptcy now affects over 100 million Americans. Mental health care? Reserved for those who can afford to wait 6 months or pay out of pocket. Rural hospitals are closing. Nurses are quitting. Suicide rates among physicians are rising, and no one asks why. The machine feeds on everyone. Patients, practitioners, even the scientists trying to fix it. Breakthroughs get buried under bureaucracy. Researchers face corporate pressure. Universities are incentivized not by truth, but by funding. And slowly, medicine becomes less about healing and more about maintaining a profitable level of sickness. And here's the cruel irony. The more we invest in this model, the sicker the population gets. Chronic illness is skyrocketing. Life expectancy in the U.S.? Declining. And while the world watches, many countries begin to copy the same efficient system, exporting a model of medical profit over human life. We've created a new kind of hierarchy, not by class or race or even geography, but by access. Access to treatment, to prevention, to survival. Those who can pay, live. Those who can't, fade quietly. This isn't just a health crisis. It's a human one, a philosophical one. Because if care becomes conditional, then compassion becomes optional. And when that happens, we lose more than our health. We lose our humanity. So the question now is, how much longer can this continue before something breaks beyond repair? So now we stand here, knowing everything. No more illusions. No more comfort in ignorance. The system is exposed, and so are we. We've seen what happens when healthcare becomes a business. When medicine stops being about healing and starts being about ownership. But the hardest truth? We helped build it. With our silence. Our compliance. Every time we accepted the absurd cost, because that's just how it works. Every time we trusted a system we didn't understand, simply because it wore a white coat. But now we know better. And with that knowledge comes a choice. Do we keep walking this path, where survival is sold in monthly payments and compassion is coded into policies? Or do we demand something different? Not just cheaper, but fairer. Not faster, but human. Because this is more than just a health crisis. It's a mirror, a reflection of what we truly value, people or profit. And maybe it's not too late. Maybe there's still time to reimagine what care should look like, not as a luxury, but a right. Not as a market, but a mission. The question is, are we brave enough to choose it? Or will we keep pretending this is normal until the cost becomes irreversible? Remember how we started this? What if your doctor didn't want you to get better? Back then, maybe it sounded like a conspiracy, an exaggeration. But now, does it still feel so far-fetched? Because if you've ever waited weeks for an appointment, argued with an insurance rep about a bill you don't understand, or sat in a sterile room, feeling more like a number than a person, then you already know. This isn't just a story. It's reality, and it could happen to you, or your mother, your child, your future self. I'm not here to scare you. I'm here to say what too many are afraid to. We're losing control. And the scariest part? Most of us never even had it. But there's one thing that can't take: awareness. And now that you've seen what's behind the curtain, what will you do with that? Will you look away or speak up? Will you share your story or let someone else suffer in silence? We need to talk about this. Loudly, honestly, relentlessly. So tell me, have you ever felt like the system wasn't built for you? Have you ever wondered if your pain was someone else's paycheck? Drop a comment. Let it out. Because the silence? That's how they win. And now that you know, silence is no longer an option.